we're going to talk about rippling, okay? So what is rippling when it comes to breast augmentation? So rippling is when you can actually see the folds of the implant, okay? So this is a silicone implant, okay? So when we put this inside the body, it actually sits in this pocket here. And as you can see, if it doesn't sit correctly, if let's say, for example, if the patient bends over and the breast falls from their body, and then they can see this right here, the rippling, then they can actually see it through their skin. And so that's something that obviously would be bothersome for a lot of patients who have breast implant. So how do we deal with rippling? Well, there are certain circumstances that makes rippling more noticeable. One, if the patient's very thin, she doesn't have a lot of breast tissue. Obviously, the more breast tissue you have, the more coverage you have, and the less you can really see. So very thin patients are more prone to it. Very thin patient meaning very little breast tissue, okay? And also, going under the muscle will provide a little bit more coverage for the rippling, okay? And then certain implant types makes rippling more noticeable, okay? So this is an silicone implant. It's a high profile implant. This is an ultra high implant, and I typically like to use the ultra high because there's less rippling, and I'll explain that in another video. But for this particular purpose, I just want to show people what rippling is, okay? And also, rippling is noticeable when the pocket is not correctly made. For example, if the pocket is too small for the implant, it may just squish the implant and make it sit incorrectly, so that way you can really feel and see the rippling, okay? And so are there treatments for rippling? Yes, there are. There are certain things that you can do. Using certain implants, for example, there's the soft touch implant, there's the gummy bear implant, which is a type of silicone implant, but it's more cohesive. The only thing with a gummy bear implant is that because there's less rippling, it has to be made a little bit firmer, okay? And when it's firmer, there's less rippling, but when you feel the breast, it doesn't feel as soft. So there's pros and cons to everything, and so by examining each patient, we can sort of, figure out the best technique possible to try to minimize the chance of rippling.